The Newport Ultra is a new innovative hip brace from Orthomerica. The Ultra has been designed to be adjusted easily, as no tools are required in the fitting of the brace, saving clinical time. The universal sizing reduces product stocking levels, and the ability to fit is now at the point of contact. The compression belt is designed with pull tabs and can easily be sized to meet the patient's specific measurements. On the inside of the belt you can see a measuring chart. From here you adjust the belt position to your desired length. If your patient has a waist under 34 inches, you will need to remove the extension pieces and swap them with the small hook and loop adaptations included in the bag. Attach the belt to the adaptation piece and ensure the long edge is in line with the hook tab. Repeat this on both sides. When securing the belt, ensure the shiny side is facing up. Slide the hook tab in and secure. There are 4 adjustable components on the strut: pelvic shell hinge, range of motion hinge, abduction hinge, and the telescopic thigh section. Below the pelvic shell you will find the proven Orthomerica hinge. The maximum range of motion is 120 degrees combined. The flexion and extension can easily be adjusted by pressing the centre button to set the desired flexion and extension. To lock the hinge, once the desired flexion and extension has been set, turn the brace over. Adduct the pelvic shell and insert the screw, which is included in the red bag with the product's instructions. To set the pelvic shell hinge, press the button in on the side and set to the required position. To set the abduction, press the button in on the side and set to the desired position. Once the compression belt has been sized to the desired length, place the belt on the patient's waist. The patient can use the finger pouch for easier application, ensuring there is a 5-inch overlap. Pull the tabs tight and equal and place on the front of the belt. Adjust the pull tab length by removing the inner handle from the sleeve and winding the string around the spool. Position the pelvic shell and hinge assembly so that it is centred over the trochanter. Once the pelvic shell is in position, remove the red tab to secure the hook and loop. Set desired flexion and extension and lock if required. If required, attach the mid-thigh pad as shown. Slide the thigh component to the desired position, leaving enough clearance for knee flexion. Remove protective strip once the desired length has been achieved. Wrap the thigh strap around and feed through the 2 D-rings for equal compression.